John, how would you differentiate between personalized medicine and personalized healthcare?
I think personalized medicine arises out of the development of medical science and the fact that we now have much better understanding of how the human body works and how individual health information can help us make a better diagnosis and a better treatment plan. But personalized medicine is set in a healthcare system, and the healthcare system is more than just the medical part. There's all kinds of other elements to it. So I think when you talk about personalized healthcare, I think we have to put on the hat of the individual patient and consider what they're looking for from their healthcare system is going to help them to get the best treatment, to get the best care provision, and how to make healthcare convenient for them as an individual.
So what are the IT tools which are emerging in this context?
Well, I think if you look at the personal medicine side, clearly there's a huge investment in new diagnostic technologies. I mean, we've seen fantastic advances in medical imaging. We're now moving into genetic sequencing as a way of gathering more information about the patient so we can make a better decision at the point of care. So on the medical informatics side for personalized medicine, I think we're quite well advanced. When it comes to personalized healthcare, I think there's still a disconnect between how the healthcare system stores information about the patient and how the patient then has access to that and how they can take advantage of that digital information to provide better insight into their condition. So some of the tools that we've seen emerging, personal health records are one example that have been tried and promoted for a number of years. When I last looked, there were about over 200 personal health record systems available. But I think they have limitations. I think they're fine if you want to have a copy element of a health record or if you want to store information about your own day-to-day condition. So they have their place, but I think what's more interesting in terms of the development of personalised healthcare is the availability of digital services and the idea that it should be possible for us to choose the channels that we want to use in order to receive healthcare, whether that's simple things like medication reminders, online booking appointments to see your GP, medication refills, or whether it's more complex things such as setting up a medical consultation with your doctor over a secured or unsecured network. These are the kind of tools that people, I think, will expect to be offered to provide them with the kind of care that they need in the 21st century.
What can eHealth solutions do to contribute?
I think eHealth is a foundational part of this, but eHealth is not the answer in itself. I mean, we know that this is really about service redesign and about how you supply your healthcare services in new ways. So it's about redesigning the healthcare services. eHealth is essential because if the patient is not moving constantly to the doctor, if the patient is, if you like, more at the centre of this web of care services, it's critical to, A, understand exactly which patient you're dealing with, so the idea of correctly identifying patients is critical. It's also very important to be able to move the health information to where it's needed, when it's needed, and that can be at all kinds of new venues that we haven't really considered. So the old medical healthcare model of moving to the doctor's surgery or moving to the hospital to have an intervention, I think, changes, and you have to be able to move the data rather than moving the patient. I think that's a fundamental thing. In terms of informatics, we've got all the technology we need now, I think, to achieve it. The thing that's been missing in a way is the standards for storing data, the standards for exchanging it. Now, with some of the big projects we're seeing happening, for example, the EPSOS project in Europe, where we are moving healthcare information across borders, we're finally seeing 23 countries collaborating around a project with the intention of allowing you as a European citizen to cross borders and have your patient record go with you. Now, for that to happen, you need to use standards, and this is one of the crucial things that we think is important. As a company, IBM is very committed to the idea of open industry standards. We were a founder member of Continua, which is the organisation that promotes the adoption of telehealth and telecare based on standards. We have been for many years a supporter of the IHE, Integrating the Healthcare Enterprise organisation, which assembles interchange profiles using open standards, and we're also sitting on the board of the EPSOS project as part of the industry contribution.
So what are the milestones and key offerings on the path towards personalised healthcare?
I think it's quite a long journey. There's not kind of one way of getting there. I think what we're seeing is, first of all, that both the medical professionals and the patients need to be willing to accept these new models of healthcare, because that's not a given. I think for many people, they value the convenience and the ability to get healthcare services when and how they want. For other people, there will be less willingness to change the model, to change the typical doctor-patient consulting relationship. So I think the first thing is just acceptance that these things have value, have benefit, and are good for the patient. The doctors accept them, and ultimately they help to manage costs better in the healthcare system. I think the second thing that's really going to make this more valuable is trust. At the moment, there's a lot of uncertainty about the status of health information. It's classified as personal information in Europe under the Data Protection Directive. Therefore, there's a lot of, I'd say, concern, confusion, uncertainty about the legal status of how this health information can be used, under what circumstances. And each country tends to interpret it its own way. So I think another key element in this, along the road to allowing this to happen, is to resolve the legal uncertainty about who is able to access health information and for what purposes, so that the population can be more confident that when they provide access to their health records, they know how it's going to be used and what the risks are that they're taking with their personal data.
So, tell us, what is your role in the healthcare sector?
My role is in the global sector in healthcare, and I'm a corporate strategist and trusted advisor to many national governments around the world, and also to large technology companies such as IBM. IBM is a client of mine currently.
Please describe one of your key projects.
One of the key projects I've been involved in is in Canada, and it was the startup of Canada Health Infoway. And this was a large national project by the Canadian government. It was as the result of ministers of health getting together in 2001 and deciding that they wanted a national electronic health record for each Canadian. So there's a huge effort in setting something up like that on a national scale when you have 33 million citizens, and it was the beginning, the first 3 years of the startup of Canada Health Infoway, getting the structures involved, making the frameworks for the provinces and the 14 governments to come together, the negotiations that went on, the plans, the vision, the strategy that was laid out in advance.
So what is the role of policymakers in large IT projects?
Well, the policymakers have a very key role to play. These are very complex situations and complex initiatives in the healthcare system, which is already a complex system in and of itself, or a multitude of systems. So the policymakers can bring some sanity, if you will, to the situation. So, for example, in privacy and data protection, one of the things that we learned in Canada was that it's very good to have a framework laid out, which is a national framework that all of your states and regions can buy into. And so it was the job of the policymakers to harmonize, first of all, to establish that framework for privacy, for example, and then to harmonize the different privacy legislation across the country so that it would enable the development of the electronic health record. So policymakers have a very key role to play in that.
Comparing healthcare IT activities in various countries, what are the critical success factors?
Well, we're seeing some very interesting critical success factors emerging as these national initiatives in health are going forward. So, for example, there are national builds going on right now in Singapore, in Australia, in New Zealand, in Canada. We've seen some in the UK, for example. We see initiatives here in Germany and other places. And so what's very important in terms of critical success factors is first to have a plan, to have a strategy that's laid out, a plan, a component of the plan, and it's articulated, and there's both healthcare leadership and political leadership that agrees to the plan and that constantly communicates that plan. Healthcare exists inside a political world, and so it's very important, particularly with the amount of money being invested in these initiatives, that there be political leadership. Another critical success factor that we see is investment that's sufficient to carry over multi-year. These builds in IT and these solutions, the implementation of them are often multi-year implementations. And so we don't want to get caught in a situation where the government budgeting cycle only gives funding for 1 year but not for multi-years. Another critical success factor is around the governance of these large IT and e-health initiatives. What we found in various countries that have been successful is that there is an entity that's been created, or an entity that already exists inside an agency, perhaps of government, that is charged with taking this strategy forward. So rather than having multiple entities doing different things, there's one single entity that has the vision, that holds the strategy, that holds the investment and moves forward, and also does benefits realization, which is critically important for more investment.